There are many illnesses that involve the nervous systems. Many are treated medically, and neurologists take care of that. Many require surgery, and that's where a neurosurgeon comes in. We are the surgeons of the central and peripheral nervous system, the brain, the spine, and peripheral nerves. So we deal with things like brain tumors, hemorrhages into the brain, brain injury, spine injury, surgery of the spine, surgery of peripheral nerves, tumors, that sort of thing, entrapment syndromes, carpal tunnel syndrome. Some of the things we do are simple, some are complicated. Patients come in many varieties, and each one has to be treated individually. Many of the people who come to me have serious problems. Even if they're not life-threatening, they are associated with bad pain, difficulty with neurologic function, and it's my job to make them feel comfortable, make them feel that I can help them, try to alleviate their anxiety, try to convince them that we can help them through a difficult time in a great place where they will be taken care of. Their safety will be paramount, and that they can expect, in many cases, that they will have a good outcome. And hopefully that will relax them, because many times they come in quite anxious. When spine surgery is necessary, it can be for a variety of different reasons. The most common reason I see someone with spine disease is because they have degenerative spine disease, something wrong with the bones, the discs, the spinal column, the bony column. And it is often not a life-threatening problem, but it can very negatively affect their lifestyle. It usually causes a great deal of pain. And if they have failed the non-surgical therapies for that sort of problem, physical therapy, pain management, then they can expect that surgery will be appropriate. But we also see patients with more worrisome kinds of problems, spinal cord tumors, serious spine trauma. Neurosurgeons are not only spine surgeons, they're spinal cord surgeons. So we work not only on the bones and the discs and the ligaments, doing degenerative disease and deformative disease such as scoliosis and curvatures and that sort of thing, but we deal with diseases of the spinal cord as well. And those kinds of problems can be quite worrisome because the spinal cord is the most delicate, most unforgiving organ in the body. And it requires a great deal of care and expertise to work surgically on the spinal cord. Routine elective spine surgery is usually quite safe. The typical things we will see would be someone with a herniated disc, an older person with spinal stenosis where the canal narrows down and causes pain, back pain and pain when they walk, primarily down the legs, something called spinal claudication. Those are relatively routine, not very difficult or complicated surgeries. And I often do those as an outpatient. Many of the patients will go home the same day, especially the younger folks. So the complication rates are very low, and the outcomes are quite good. Patient satisfaction is high. Jefferson Health has a very broad range in the Delaware Valley. There are many sites where someone can be seen, a patient can be seen as an outpatient, and where they can have their surgery. I am housed primarily at Abington Hospital and Lansdale Hospital, which are parts of Jefferson Health. And it's great for me because I work in an institution that has a fabulous reputation. It's a long-standing member of the community where I work. It's been around for over 100 years. It now has the support of Jefferson Health, which is a major health institution in the Delaware Valley. So you put that all together and it makes it a really wonderful place for me as a professional and as a surgeon to practice my surgical care. I am Dr. Stephen Barrer. I'm a neurosurgeon, and my mission at Jefferson Health is to improve lives.